talk about social distancing and not social isolation. And I'm going to give you a little brief overview of the Ombudsman program, just so that you know where I'm coming from. I know that Mary Grace just gave a little bit of my bio, but I wanted to just share a little bit more of what we do. So the Long-Term Care Ombudsman program, we are a federally mandated program. We are located in every state. I'm the state ombuds. And just to let you know that we advocate for people who live in licensed long-term care. And those are places such as nursing homes, assisted living facilities, adult family homes, enhanced care facilities, veterans homes, and residential habilitative centers. You might know them as Lakeland Village, Yakima School, Fircrest. So we have about 300 advocates, most of them volunteers, who visit residents in long-term care settings across the state. And our primary objective is to promote and protect the rights of long-term care residents. And pretty much our sort of our bread and butter of what we do is we do complaint finding and resolution. So we're in there in the facilities meeting with long-term care residents, the workers, the staff, and family members to find out how we can help them with their care, help them with their quality of life and any issues that need resolution. And we do this confidentially. We do this as a resident-driven approach, meaning we focus on the consumer. And just so you know, we don't call people patients who live in long-term care, we call them residents, just to clarify some terminology. And so we advocate on behalf of the long-term care resident. And for residents who may require some support, they have a family member or a power of attorney, we absolutely work with those individuals as well. But our goal is really to focus on the person and what they want and what their wishes are. You can kind of view us, our relationship similar to an attorney-client relationship, or maybe a domestic violence advocate in their relationship. So the relationship between the resident and the ombuds is a trusting relationship. Everything is confidential. We are not mandated reporters. So that is unusual in health or long-term care. And then, as Mary Grace mentioned, we do systems change on a macro level, meaning we work with state legislators, policymakers, to make improvements in the long-term care system. We receive lots of complaints and concerns, and these are really based in a body of federal and state civil rights. They're called resident rights. And so just wanted to give you an idea of the types of complaints we hear. Everything from food and snacks to care issues, quality of life issues, autonomy, privacy, confidentiality and choice, respect and dignity. And then the thing that we're going to talk about today is really about keeping socially connected. And that is connected to the legal right to visitations, to access. So access to your community or access to the facility if you're a family member outside of the home. And really communication, access to communication and being able to communicate with whoever you choose, whoever the resident chooses. So we're going to talk a lot about that today. So as you know, during COVID-19, we've seen some unprecedented restrictions and changes happening due to concerns about the spread of COVID. So my talk today will be focused on what's happening right now. You know, things can change tomorrow, and they certainly have changed over the last 8 months. But right now, we still have some restricted visiting, meaning not everyone can go into a long-term care facility. So residents have limited access to their outside community, access to their friends and family. The facilities have received waivers through proclamations and federal law on some of the things that they normally would do in terms of consumer protections. I'm not going to go deeply into that. I just wanted you to know that, you know, the laws have sort of changed temporarily, and that is to allow for flexibility in operations during COVID-19. However, you know, there is a plan under proclamation that the governor has issued as of August 12th that has sort of relaxed and opened up visitation and access a little bit. It could be better, but it's a start. And this plan really spells out who can visit, when, and how. And then I want you to know, though, that even though there's a plan under proclamation, that each facility administrator, they've been given a lot of discretion on how to implement that plan and how far they will allow visitations to go or open up. So we'll talk a little bit about that later, and I'm sure you might have questions, especially if you have a loved one living in a long-term care facility. But the bottom line is that the law and the rules support the fact that the facility must help residents exercise their rights to communicate with others. So, you know, the bottom line is that people who live in long-term care have a right to communicate with others. They have a right to communicate with their lawyer, their family, friends, ombuds, doctor, their church, groups outside of the facility. What's really been restricted is how that can happen during COVID. And that's been problematic and frustrating during this time. But I think we have some ideas and some solutions that I'd like to offer to you today. And these aren't things that I thought up. These are definitely best practices that have been recommended from experts and from, you know, real life consumers and facilities that have tried these things. So this here, I just wanted to give a brief glimpse. At the very end of this presentation, there are some resources, and you'll be able to see this particular grid if you go to the link that I provide. So, and then also this PowerPoint will be made available to Mary Grace, so she can share this with you. This is just the part of the Governor's Safe Start Plan. It's just a brief sort of summary table that shows what kind of visitations and connections can happen. I don't want to get into all the different phases. It's complex, but I just wanted to show you that there is a plan, there is a formula that facility administrators are supposed to follow. And certainly we're happy at the Ombudsman program to help you sort of decipher what phase or what's being allowed at the facility, depending, you know, what county you're in, probably King County. We're happy to decipher that for you. But I just want to let you know that there is this sort of plan. And then the two photos I just wanted to share with you is, number one, there are indoor visitations happening in some facilities, and this is what it might look like. People are all masked up, they're social distancing, they may be meeting inside a designated room versus in a residence room. That's to sort of control who's going in and out of the building and down the hallway, right? Or if the resident has a roommate, you know, it's to, again, for safety precautions. And then the bottom photo, you know, everyone who enters the building, essential visitors, family members, workers are all screened. And if you don't see that happening, don't go in the building. That must happen before you go in the building. So with the governor's Safe Start Plan are rules and criteria, and one of the criteria is you must be screened, you must follow infectious control practices. So just wanted to share that with you, just to let you know that it's not a free-for-all. What you can expect right now, I think in every county, every region of the state, are outdoor visits. These are definitely being encouraged and promoted. And right now, facilities are planning on how can they facilitate outdoor visits as the weather changes. We were sort of godsmacked in the middle of this summer when the wildfires started. and the outdoor visits stopped because of health concerns due to the smoke. So they're scrambling right now, not scrambling, they're planning, and they're working with state officials, they're working with federal officials to figure out ways to do outdoor visits during the winter months. And the reason why they want to do outdoor visits versus indoor visits is because of air circulation. It's better to be outside during COVID-19 where there is good air circulation versus being in, let's say, an enclosed space. So it's how do you provide an outdoor shelter that is not an enclosed space that still allows, protection from the elements, but also be able to facilitate good air quality. Some of the facilities, many of the nursing homes in Washington State are old constructed buildings. I'm talking from the 50s, 60s, 70s, as old as I am. And so the air quality and the HVAC systems are not necessarily state of the art. So newer buildings, maybe not as much worry, but the older buildings, the air quality may not be as good. Some buildings have rooms with windows that open and some do not. So outdoor visits, you can see the lady here with I think she's got a white blanket on. They've constructed this sort of makeshift plexiglass outdoor room where the family can come and visit without being fearful of being exposed. In smaller settings like adult family homes, you might see visits happen in the garage. They might actually open the door and then set up like a little living room in the garage that allows airflow. So there's been a lot of creativity, a lot of visiting going on, a lot of window visits going on across the state. Sometimes the window's closed, sometimes the window is open. If it's closed, you might see people using their telephones to speak to their loved ones. This is just a picture of a group of people. Let's just say it's a family getting together. They're socially distancing and they're outside on this patio here. So, they're bundled up. That's okay. At least they get to see one another. Technology has been the big answer. As you can see right now, we're using Zoom. Technology has been the big sort of answer to COVID-19. Everything from social visits to healthcare visits, medical visits. Many long-term care residents have smartphones. This is a way we as the Ombudsman have been communicating with residents for several years. So they have email, they have text messaging, and maybe they just need to learn how to use Skype or Zoom or the Facebook video conferencing. Many of the larger facilities like nursing homes and assisted living can apply for grant money to buy technology for the facility. So facilities should have tablets, anything like iPads, or they might be using the GrandPad system. So they should have some kind of way to facilitate video conferencing, virtual visits. There should be no excuse. And the actual federal law says they must help residents in doing this and providing this type of system. So that's a requirement because we want to make sure people are connected and stay emotionally healthy. And being isolated the way they have been it's not good. It's not good for us. Many residents have Kindles, which can also facilitate virtual conferencing. And so that's the high tech. And then the low tech, again, are window visits. I think, if you've watched the news or read the newspaper, you've seen how people are visiting outdoor the windows, and they might have the large signs or a whiteboard like this woman has here. She's got a whiteboard and she's writing notes to her mother. And here we have a family member or friend visiting using a phone. I think the window's a little bit cracked at the bottom. So maybe the phone just adds some extra help with hearing. And then we have the woman in the green. She's reading a letter. And I know it's funny, who writes letters anymore? But letters are great ways to communicate with people who live in long-term care. It was my first job in 1988. I worked in a nursing home, and my job was to distribute the mail to the residents in the nursing home that I worked at. And I can't tell you how much getting mail was really meaningful. I would read cards, I'd read letters, I'd help them open their letters. Getting a newspaper. Newspapers aren't as robust as they were back in the 80s, but getting a newspaper was really great. It was something to look forward to every day. So reading materials and just corresponding, low tech is absolutely fine and acceptable. And the facility should not be withholding any mail. There's very little evidence that shows that COVID can be contracted via, mail. And then we have, I just want to quickly go through care packages. These are ways to stay connected with loved ones and friends in long-term care. Get really creative. Think about, in the beginning we thought maybe this would be a 3-month thing, but now we realize that, this might be much longer, right? So really get creative. I'd like to encourage, if you're thinking about gift giving for birthdays or holidays, to think about subscriptions. There are so many great affordable subscriptions out there now for things like food, snacks. You can get like vegetarian and gluten-free snack boxes. I've seen those on Amazon and other types of businesses, or you can make your own care packages. And I want to just emphasize how important snacks are. In fact, I had snacks down twice on this list. Snacks are really, really important in long-term care. And I'm gonna be really honest with you, and I hope not to offend anybody who maybe lives in long-term care or works in long-term care. But if you just think about sort of your individual diet preferences and tastes, it's really hard to have these mass kitchens cook meals in a way like you and I cook our meals maybe, right? And so snacks become really critical to supplement those meals and, to meet those changing taste buds that might change due to, medication or just aging. So snacks, I don't think you can lose with snacks. And then technology gifts are great. If your family can pool together their money, maybe to buy a Kindle or a tablet, or headphones are really important. And really you have to think about the ergonomics and accessibility of the tablet. So I encourage you to really think about that if you're getting any kind of technology. Right now, people are not necessarily able to go out and do the shopping that they've done in the past. Many facilities in the past have provided activities where they would go on shopping trips, where they would, have a van full of residents and maybe go on shopping trips. Those aren't happening as much anymore, right? So just think of the things that, you run out to get. Those are the things that could be helpful to the residents. And then I added extra clothing for layering and warmth and wind and rain protection, just in case we continue to see outdoor visiting during the winter months. In a care facility, your best friends are going to be the activities people. These are the women with the bunny ears. They don't all wear bunny ears, but it's fun, right? Looks like they're celebrating maybe spring or Easter here. And then your social worker, and I'm just guessing this guy here in the red with the whiteboard is a social worker, right? These are the two groups of paid staff that you're really going to want to build relationships with in order to make sure that things like care packages get open and delivered, and activities are planned in a way that are individual activities or group activities. These are the folks who, to me, besides the nurses, they're the heart of the facility, and they can really make a difference in the quality of life that people experience. They're the people you can go to if you have concerns and complaints as well, right? And I just wanted to share that there are still activities that are happening in facilities. There are some facilities that are struggling, and if you happen to be associated with one, you can take these ideas to them and help them sort of creatively problem solve. But we see things happening in the hallways, bingo happening in roomway doors. We still have religious and spiritual services happening either through video, or chaplains are actually dressing up in PPE and they're going into the facilities to meet the spiritual needs of residents. We have entertainment, we have music going on. I think there was one slide I had where people were standing outside, people were looking out their balconies and listening to music. So things like, you know, these are the things that we all depend on to have quality of life, and they should continue during COVID for long-term care residents. So I went through that pretty quickly, but I wanted to leave enough time for questions. These are resources and contacts. I did provide Mary Grace some fact sheets that were focused on residents and families of residents. So she can share those with you, or you can go on to the National Consumer Voice for Quality Long-Term Care website for information and to check out those fact sheets. They also have some podcasts on there, and they have some webinars on there that you might find helpful. Everything from some of the ideas that I've shared to things like self-care, which is really critical right now. We are living during a time of, I'm just going to use the word trauma, right? And self-care is incredibly important for yourselves as family caregivers, for yourselves as people living with memory loss. If some of you are professional caregivers, you know, burnout and fatigue, compassion fatigue is real. I know I've hit the wall a couple times. So there are many things that are happening in long-term care to keep people connected. And the Ombudsman have been mailing postcards into the facilities. We've probably distributed 40,000 postcards over this time to provide our phone number, which is listed here. You can call us anytime. We'll connect you to your local Ombudsman office. All calls are confidential. We do a lot of information and referral as well as complaint resolution. So just because you call us or email us doesn't mean that you've got a complaint. You might just have a question. And then the last website on here, the last two websites are associated with the State of Washington Department of Health and Social Services. I just wanted to share, let's see if I can do this. Oh, I don't think I can. Oh, well, that's okay. The FAM Help website has a couple really good resources on there. One is a list of facilities that currently have COVID-19 cases affiliated with it. That list is updated daily, except on the weekends. So if you're looking for a facility or just curious what's going on in your community, that's a good resource. It also has the Safe Start plan that talks about the different types of visitation that's allowed and access to the community. And then the very, very last number there, that is the DSHS Facility Complaint Hotline. That is a phone line that you call if you have a concern and want to make a report about abuse, neglect, or lapses in care. You can make a complaint to that phone line. You can ask for it to be confidential if you have a concern about that, but otherwise, yeah, you just leave your name. It's all prompted. You answer the questions, and they will send a complaint investigator to the facility to go inside and investigate the situation. So that's it for me for now. Any questions?